This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
A rare disorder is defined as a debilitating condition with a prevalence rate of 0.65% to 1%. This is according to the World Health Organization.
Rare disease kasi is a condition wherein if in the population, the incidence of the disease may range from 1 is to 2,000, to 1 is 20,000, to 1 is to 30,000. But actually, this is dependent from country to country.
Today, there are 6,000 to 8,000 rare disorders in the Philippines, the majority of which affect children, according to the Philippine Society for Orphan Disorders. These are muscular dystrophy, maple syrup urine disease, mucopolysaccharidosis, and many others.
Yung iba naman, hindi mo kaagad nakikita ang manifestations until the child is already walking or until the adolescent period.
While the exact cause for many rare disorders is still unidentified, the National Human Genome Research Institute has, through the years, looked into some possible causes, such as mutations in a single gene and even environmental factors such as smoking and exposure to hazardous materials.
Marami pa talagang mga rare diseases na wala pang cure. Sometimes hindi natin masasabing cure parang modification lang ng expression.
What are some common characteristics of these rare disorders? Is muscular dystrophy always hereditary? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Ida Salonga. She's the head of Child Neurosciences at the Manila Doctors Hospital. She's also a fellow of the Philippine Neurological Association and Child Neurology Society of the Philippines. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Salonga. Welcome to MedTalk.
Good evening, Angel.
Tonight, we will be understanding, discussing, and learning more about rare disorders. So, Doc, what is a rare disorder?
Rare disorder, we usually would call a rare disorder if it doesn't fall under the listing of the more common diseases that we encounter in daily life, no? Like, for example, diarrhea, pneumonia, stroke, cardiovascular diseases, and the rest of that I would call. Usually, the rare disorders are actually seen in, let's say, in some cases, in 1 out of 2,000 population or live births. For one rare disorder that has already a database, the Duchenne muscular dystrophy, it's the incidence is 1 in 3,500 live births. No? So depending on the country, probably in the healthcare system of the country, the definition of rare disorder is actually varies.
So here in the Philippines?
In the Philippines, the Society for Orphan Disorders define rare disorders as 1 in 20,000 population.
Okay. And does this affect only children? Does it affect adults? What is the, how would you say that, the population that is affected?
Population. Yes. Majority of the rare disorders actually are expressed in childhood. When I say expressed, because most of the rare disorders are actually genetically linked, no?
Okay.
So they are mostly inherited. But their expression, the expression of the disease doesn't happen always in childhood. There are some that are actually expressed in the late life, late adolescent, or even in adult life. No?
So
But majority would be in the younger population.
Okay, so why is the younger population affected by a medical condition such as
Why
this?
the younger
Yes,
or
Doc.
probably not why the younger population, but probably it is what the disorder itself.
Okay.
The disorder itself that actually, I mean, the type of gene mutation that would lead to some kind of a disorder that when it affects a population, the vulnerable young population would always be the one that would be mostly affected. No?
Okay.
So some of the disorders may be expressed even at birth.
Okay.
Okay. Probably a good example would be, I think a lot of people have heard of the maple syrup urine disease, right? Okay. Those are expressed during infancy or even at birth.
So the urine maple urine maple syrup disease is a metabolic disease,
Yes,
disorder.
it's a disorder in metabolism, right? Okay. So patients would manifest with either they at birth they may be seen as have some difficulty in feeding, and then they would not wake up. We call them hypotonic. Hindi masyadong magalaw, no?
Oh, okay.
And then they would have some seizures, no? Okay. If usually common diseases that would cause this would be either there was difficulty in delivery, or probably there is infection that we call neonatal sepsis. But if those things are not actually present, then you think of possible inward error of metabolism, which is actually a rare disorder. So those are the possible examples, no? Like, but in some other conditions, like for example, I think a lot of people know already about Duchenne muscular dystrophy. In muscular dystrophy, the children are born normally. They have normal development until about the time that they are walking. By 2 to 3 years of age, they started to regress in their motor function.
So paano yun na-diagnose, Doc? Early on, para maabangan na, or so you can treat the disorder early on in life?
Early on, paano ma-diagnose?
Yes.
Well, dapat meron kang isang index case sa family. Meaning to say, merong isa na-affect sa family. And from then on, magiging suspect mo yung ibang mga members ng family, di ba? But, dun ngayon pumapasok yung significance ng making a very good history, clinical history, parang meron tinatawag kaming pedigree. Iti-trace mo as far back, as what the family can remember, no? Kahit kung pwedeng unto the 3rd or 4th or 5th generation.
That far along?
Oo, bakit ganon?
Yes.
Kasi diba, inheritance ang pattern niya. So, merong kasing ang inheritance pattern ay yung tinatawag na, merong 4 classical diba? Merong kanong tinatawag na autosomal dominant, autosomal recessive. Autosomal dominant, lalabas sa lahat ng generation. Diba? So, lagi kang may isang affected na parent. Autosomal recessive, pwedeng wala kang affected na parent, pero pwedeng lumabas, nag-i-skip naman ang mga generations yan. Pagka naman X-link, yung X-link na dominant, lalabas yan sa lahat ng male, kasi X, sa lahat ng female. Kasi X lahat ng X pwedeng affected. No? Pagka naman X-link recessive, parang yung Duchenne, mostly sa mga batang lalaki lang lalabas yan.
Passed on by the mom?
Passed on by the mom. So, halimbawa may index case kang ganon sa pamilya, then pagka mayroong mga ganong symptoms, nagsususpect ka na. Or going ahead, pwedeng magpa-test yung other members of the family kung meron silang trait for that. Yun ang ginagawa ng gene test, genetic testing, no? Oo, mga DNA testing. So like I have a family with Duchenne muscular dystrophy, no? So napatest nila yung ibang members ng family, no? So, parang careful na sila, of course, no? I mean, aware na sila na there is a possibility, there is a chance na pwedeng pag lalaki ang anak ko, 1:4, probability na pwedeng ma-affect yung bata na yon. Oo.
Doctor, what are the, we're going to cut to a break now, but let's leave them with something to think about. What are the common problems faced by the physician and the family when diagnosing rare disorders?
Okay.
We'll talk about that when MedTalk returns.
In the Philippines, a rare disorder affects roughly 1 in every 20,000 individuals or less, as defined by the Institute of Human Genetics of the National Institutes of Health, University of the Philippines, Manila.
We're back here on MedTalk, still talking about rare disorders with neurologist Dr. Aida Salonga. Doctor, before the break, I asked you a question about the common problems that the physician and probably the family members will face if one of your family members has a rare disorder.
For the part of the physician, the most important thing is the physician should have a high index of suspicion that these things do occur, no? Okay. If you're confronted with a patient with multiple, symptoms and manifestations that may not really fit common diseases like secondary to infection, secondary to cardiovascular disease, then especially if this is a young patient, then, and it involves, we call it multi-organ, like it doesn't only involve one system, then you consider the possibility is, am I dealing with a rare disorder, no? And from then you have to be very, very meticulous in doing your history. You cannot do a 5-minute history. It has to be probably at least 15 to 30-minute history going back to, as I said,
even to the 5th generation.
Diba? Okay. And being very specific with the symptoms, no? Now, for the part, and then of course, for the physician also, what is most important is deciding on what test to request, no?
Okay.
Primarily because we have to prioritize, because most of the patients are actually out of the pocket. The expenses are out of the pocket, no? And even if they have, this medical insurance, do you know that they would not actually cover for this supposedly congenital disorders, no? Okay, so we really have to find out, to face, this is laboratory test, because there should be a sequence of laboratory tests. So that is also shared by the parents. But the most important thing for the parents, or the most important problem that we encounter, is actually acceptance by the family, especially if they already have one member of the family that's affected. It's actually, of course, the pain initially of accepting that, oh my God, my child has, no? And at the same time, probably also, trying to right away, because think of hopeless na siguro, wala na, para mga ganong bagay, no? Plus, of course, again, the burden of cost in diagnostics, no?
But because the physician will do a very thorough genetic testing, then there are certain ways and treatments that may be given to the patient to alleviate this pain that they will
because
feel.
It should be emphasized that even if this is a rare disorder, there are interventions that can be done, especially if they are brought to the attention of the physicians early on.
You mentioned brought to the attention of the physicians, early on.
Yes,
yes. Doctor, there are tests and diagnosis. What are you looking for? What are probably the signs and symptoms that you aim to find during the test to be able to diagnose the patient properly with a rare disorder? Yes.
Okay. If we already are able to look at the constellation of signs and symptoms that the patient has, then we initially make what we call a clinical diagnosis. This is actually what we are always telling our students. No, we cannot be replaced by robot or by this expertise in technology, because only us physicians will be able to make the clinical diagnosis and try to determine exactly what could be the problem of this patient. What could be the disease entity that this patient is having that will be having all of these clinical manifestations. And from there, we try now to look at the most prominent symptoms.
Okay.
Like, for example, if the most prominent symptom is related, for example, to motor, like difficulty in walking, weakness, then we do tests for motor function. First is,
Doc, you mentioned, no, I apologize to cut you there, but I remember that it affects children. So the motor skills of a child, when should they be seen, at what age, and what kind of motor skills should the parents notice, and that it should be the type of motor skill appropriate for the age of the child?
Yes. Well, of course, parents, especially young parents, they should know what we call the normal milestones. When are the children expected to talk? When are the children expected to lift their head? And when they are expected to hold their battles, right? Sit and stand. If this process is actually delayed, because usually by 9 to 10 months of age, they should be able to stand on their crib, right?
Yes.
And by their first birthday, they should already be taking
one or two steps,
right? Okay. Now, if that process is not attained, then this is what we call, you suspect some delay in motor development, right? And so right away, consult your physician, your pediatrician, and try to say, is there really a delay, no? Okay, baka naman dahil karga lang lagi, no? Okay. But the neurologic test will be able to do that. That's why we do some reflex testing and all, no? Now, after that, then what is most important also is regression in development. That is very, very important. A child that chooses to walk already by the age of 1 year, 1.5, by 2, he is already walking on his own and happy. If after that, on his second birthday, he would no longer be able to do what he used to do in terms of walking up the stairs and all, then suspect that there is really something wrong. O kung laging nadadapa-dapa, di ba, no? Laging tapa siya ng dapa, hindi, lampa lang yan, clumsy lang yan, no?
Parang there's a reason or an excuse, no?
Yes, there is always an excuse. Hindi, karga lang yan lagi, no? Make sure that, laging tinitingnan natin ang husto. Kung talagang yun ang reason or regression ba yun? Kasi pag regression, then right away be alarmed. Kasi importanteng madala ka agad sa Huwag therapy agad. Importante malaman ano ang cause, ano ang dahilan. Oo, bakit delayed ang development? Ano ang dahilan niya? Meron bang iba pang mga kasamang symptoms? Di ba?
So, Doctor, you mentioned delayed in development.
Yes,
Another rare disorder, would you say it's common in the Philippines, is muscular dystrophy? Would you say it's common?
Naman siya among the more common muscular dystrophies. Yung Duchenne ang mas common.
Okay.
Oo, pero hindi siya common.
So it involves of the motor skills, and does it involve a child or does it involve the teenage years? Doctor, we'll talk about that. We have a case study involving a patient with muscular dystrophy. We'll get to know him when MedTalk returns.
Muscular dystrophy is a rare genetic disorder characterized by muscle weakness and severely affects a person's mobility and independence. Most cases are usually evident in early childhood. But for Ramon Alipado, he first noticed the telltale signs of the disease in his teenage years.
It all started nung ako ay third year high school. Ako ay nagtitraining for CAT that time. I was 15 years old. And then during the training, naramdaman ko na lang na nanginginig yung aking tuhod. So habang kami nagtitraining that time, nagtataka sila bakit daw kung magmarcha ako ay nanginginig.
His knees were weak and he had problems walking and moving around.
College ako sa Quezon City. Ako ay sumabit sa jeep. Nung tumakbo yung jeep, biglang nawalan ako ng pwersa sa kamay at nahulog ako sa jeep. Yun yung time na sabi ko, ano kaya ito kako? So it's about time na magpa-check up na.
A biopsy revealed that he had limb girdle muscular dystrophy.
Ito ay namamana at hindi siya nakakahawa. So sabi pa niya, progressive ito. So habang ako ay tumatanda o nagkakaedad, lalo akong nanghihina at yung mga muscles ko sa katawan ay nagiging taba o nawawala. So if you will compare my strength that time sa strength ko ngayon, malayo na. Kasi ako ay talagang wheelchair user na ngayon. Hindi na ako nakakatayo.
He later discovered that his younger brother is also suffering from muscular dystrophy.
Yung sa brother ko naman, ang sabi kasi ng doktor, given na yon na may muscular dystrophy siya. Kasi nga, ito ay present only sa mga lalaki. Kaya yung kapatid ko noon, nakikita ko siya, pag kumilos, the same manifestations nung nagsisimula pa yung muscular dystrophy ko.
Now 37, Ramon continues his everyday journey to fight this incurable disease.
Siguro yung transition ko from an able person na ngayon ay person with disability na, ay matagal. Matagal yung transition eh. Pero nung napunta ako ng tahanang walang hagdanan to work, nagbago rin yung pananaw ko, mas naging positive yung outlook ko sa buhay. Although yung condition ko talaga, as I get older, I get weaker, pero nagagamit ko kung ano yung meron ako ngayon. Importante yung nagagawa mo pa. So, kung tatanungin mo ako ngayon kung ano yung epekto sa akin ng aking karamdaman, I'm more positive in life. I learned to live life to the fullest. At ang sinasabi ko nga sa sarili ko, just learn to live life every day. Kung ano yung pwede mo pang gawin.
We are back here on MedTalk, still talking about rare disorders. Doctor, as we've seen in the video, Ramon Alipado was diagnosed, or rather, he noticed that nanginginig yung tuhod niya during CAT training. High school na.
Right.
So, pwedeng high school pala mag-manifest muscular dystrophy.
Muscular dystrophy.
What exactly, Doctor, can you help us understand and describe to us what muscular dystrophy is and how does it affect our body?
Okay. Ang muscular dystrophy kasi is a disorder that affects the muscles of the body, pero mostly the limbs and the trunk. Hindi kasama ang face.
Okay.
Yan sa muscular dystrophy, no? Okay. But there are several types of muscular dystrophy, no? Actually, I think there are about yung sa kanya kasi limb girdle muscular dystrophy.
Yes.
Yung limb girdle muscular dystrophy, merong almost 15 subtypes yan eh.
Okay, may subtype pa pala yan.
Oo. So, ibig sabihin...
What do you mean when you say subtype?
Parang based on kasi ang reason kung bakit sila nagkakaroon ng weakness ng muscle. Kasi nagkakaroon ng mutation dun sa gene that codes the protein that is responsible for proper functioning of the muscles. Diba, no? Okay. Like yung sa Duchenne dystrophin, no? Etong sa limb girdle muscular dystrophy, maraming iba-ibang protein ito na nakita nila na kaya madaming subtypes, no? And ang pattern ng inheritance, meron siyang autosomal recessive at merong autosomal dominant. Itong sa kanya, baka autosomal dominant, di ba, no? Kasi dalawa siya sa kanilang family na parehong lalaki din, di ba, no? Now, or pwede ring X-linked, depende, no? Dito ngayon pumapasok yung importance ng doing some genetic studies. Kasi pag ginawan mo ng genetic studies, ito kasi ang tutulong sa'yo para malaman, una, aling muscles lang ang affected. Diba? Pag sinabi mong limb girdle, diba? Limb girdle, yung pelvic muscles, no? Diba? Okay. Pero pwede rin na apektado ang heart muscles ng iba. Okay. And then, in some subtypes, pwede ring affected ang intelligence. Okay. Oo. So, dito ngayon, nagkakaroon ng halaga yung paggawa ng mga genetic testing. Kasi kung makita mo kung aling protein ang deficient or aling protein ang abnormal, ang gene for protein ang abnormal, then mapoprognosticate mo. And from there also, pwede kang makagawa ngayon ng parang planning for intervention. Oo, para sa kanila. Dito mo din malalaman kung ano ba yon, progressive ba yon, rapidly. Dalawa kasi ang forms niyan eh. Merong rapidly progressive, yung mabilis ang course.
Parang na-mention niya, no, na progressive.
Oo, yung sa kanya, mukhang slowly progressive. 37 years old na siya. Nagsimula siya nung high school, di ba? Oo. So, parang mga 20 years na itong sa kanyang ito, no? And yet, kita ko yung kanyang mga daliri, di ba? Nagagamit pa din niya, nakakapag-type pa rin siya, no? Which is very important. And I think kaya siya ganyan, kasi maganda ang naitulong sa kanya ng intervention, for which therapy is one of the most important part ng intervention.
So, aside from therapy, are there certain medications, certain treatments na one has to go through? Well, one, not therapy, is a frame of mind, state of mind eh. Yung he's very positive. Kaya,
yes,
di ba,
yes,
you know, he feels a lot better knowing that he has this disorder.
And there are some other people who has worse disorder condition than him, di ba? Siguro gusto ko munang i-share, bago yung treatment, bago yung intervention, ano yung ibang diagnostic test?
Yes, please.
Di ba, no? Yung kanina, sabi ko, yung neurologic evaluation, di ba? Tapos, ang isang pinaka-importante is from the neurologic evaluation, dapat ma-distinguish mo kung yung weakness ba ay dahil talaga sa problema sa muscle, dahil ba sa nerve, o dahil ba sa spinal cord. Kasi pwede kasing spinal cord ang problem, di ba? Katulad yung mga ALS, di ba? No? Oo. So, titignan mo yon, neuropathic, we call it neuropathic, myopathic, or dahil ba sa cord problem. So, doon mo ngayon, yun naman, makikita mo din with a very good neurologic exam, magkakaroon ka ng idea kung alin doon, no? So, what are the tests that are being done? Kung iniisip mo na gusto mong malaman kung hindi ba cord ang problema, baka mamaya may tumor naman pala sa cord, di ba? Then you do an MRI of the spinal cord, no?
Okay.
Kung ano naman, kung iniisip mo ay nerve pala siya, then you do a nerve conduction velocity test. At tawag doon NCV. Kung iniisip mo naman ay muscle, then you focus on the electromyography, EMG. Together with, of course, for nerve and muscle, then we do that EMG, NCV, at saka yung muscle biopsy. Oo. Now, may specific na mga stains na ginagamit ang mga neuropathologists. We also have neuropathologists and we have very good neuropathologists in the country who can actually help us in zeroing into the diagnosis kung ito ba ay myopathy, or kung ito ba ay neuropathy, no? Okay. And then from there, then ang sunod mo naman is kung myopathy or neuropathy na sa tingin mo mukhang ito ay parang possibly hereditary, makikita kasi namin sa pattern, then you go for genetic studies para ma-identify specifically anong klase siya and then meron na bang possible na ibang intervention or treatment na pwedeng ibigay sa kanya, no?
Doctor, dun sa nerve, muscle, and spinal cord, meron ba silang common trait or common manifestation na baka ma-misdiagnose.
Yes, oo.
What
Oo.
would that be?
Paralysis. Paralysis of all the extremities, halimbawa, no? Then may pattern. Nauna ba yung paa, paakyat ba? Yung tinatawag na ascending paralysis, or kamay, pababa, descending paralysis. So, makukuha mo yan sa history. At saka yung very good neurologic evaluation.
So, history, good neurological
Yes.
evaluation, you really have to dig deep, no? Talagang
Right.
kailangan puntahan yung cause to be
Yes.
able to treat the disorder well.
Yes, to determine kung
determine
nasan
rather.
siya. Alam mo, gumagawa ng neurologic exam para kang nag-jigsaw puzzle.
Okay.
Tinitingnan mo kung alin siya, no?
Okay.
And they are all, because of doing very meticulous, like reflexes, sensory testing, yung mga ganon.
So parang you're trying to piece everything together
Right,
and form that puzzle so you can treat the patient well.
Para makita mo, alin ba yung involved? Proximal muscles ba? Big muscles ba? Yung bang small muscles of the hand, di ba? Big muscles ba of the hip? Kasama ba ang respiratory muscles? Yun.
In Ramon's case, Doc, na naka-wheelchair na siya, but he's still able to once in a while use his hands, no? What other treatment should he undergo?
Siguro, i-enhance lang kung hindi pa ginagawa. Pero mukha naman yatang maganda na ang niya. I-enhance lang yung kanyang physical and occupational therapy.
Okay, so that's
para,
when therapy comes in.
Yes, yun na tinatawag yung intervention. You were mentioning earlier, treatment. May treatment ba? Actually, wala pang definite treatment, especially for muscular dystrophy, di ba? No? Oo. Except for ang medication na ngayon ginagamit will be steroids. Pero hindi siya talagang treatment. Steroids specifically for Duchenne muscular dystrophy. Pero hindi siya treatment for cure. Ang treatment na ginagawa for dystrophy is actually to delay the progression.
Okay.
Right? That's one.
Yes.
The second is to prevent complications. Ano ba yung complications? Complications kasi hindi ka nakagagalaw eh. So, pwede ka magkaroon ng contracture. Pag nagkaroon ka ng contracture, dito, halimbawa, hindi mo na maiganon, hindi mo na lalo magagamit yung mga extremities mo. And then you will have mga arthritis, you will have pain sa mga joints mo and all, no? And then lalo lang mag-atrophy yung iyong muscles, no? The other important thing is, alam mo yung protecting your rib cage. Kasi pag protect mo yung rib cage mo, yung respiration mo will not be too much affected, di ba? And how do you protect that? Yung spine, pagka kasi mahina ang muscles mo, nagiging parang hands baka gano'n, di ba? Nagiging,
yes.
nababaloktot ka. And then so you develop what we call parang kyphosis, yung bumabaloktot na gano'n. And then scoliosis, yung umiliko. Kasi paano bang position ng karamihan ng mga taong may weakness? Pag gano'n sila, no?
Yes.
Pero I'm happy with Ramon. Kita
He's
ko yung
upright
position
eh.
Right. So, ibig sabihin maganda ang kanyang training, no?
Common ba siya sa Philippines, Doc, before we cut to a break?
Common sa Philippines,
Muscular dystrophy.
Madami naman ako nakikita, pero hindi naman ganun kadami. Pero wala pa kasi tayong talagang data, yung database on kung ilan. Pero gumagawa ang I think may database na ginagawa yung grupo nila Dr. Padilla at Dr. Eva Cochanco de la Paz sa NIH, no?
Okay. So, Doctor, how about a support group for those with orphan disorders or muscular dystrophy? We'll talk about that when
sige.
MedTalk returns.
Okay.
According to the Philippine Society for Orphan Disorders, or PSOD, 75% of rare diseases affect children, with 30% dying before the age of 5.
We're back here on MedTalk, still talking about rare disorders. Dr. Salonga, before we go to the support group for rare disorders or orphan disorders, sino ang mas prone to get the disease, the disorder rather? Lalaki ba or babae? Any particular age group?
Depende kasi yan sa sa gene mutation at saka sa disorder. So, yun nga, di ba kanina yung patterns of inheritance, no? Kung ang makita mong pattern of inheritance dominant, then equally pwedeng affected ang babae at lalaki, di ba, no? Pero kung X-link siya, pag dominant na X-link, mas madaming babae kasi madaming X dun sa chromosomes ng babae. Pero kasi pag na-affect mo na isang X, ano na yun? Affected na siya, di ba? Pero kung X-link recessive, mas madami ang lalaki.
Okay.
Oo,
Gaya
pero
dun
ang
ba
carrier,
sa case ni Ramon, yung case study natin na dalawa sila ng
Na
kapatid
parehong
niya,
lalaki.
ng lalaki, who have it, tas yung mga kapatid niyang babae don't have it.
Wala. So, baka, oo. Yun ang significance nga nung examine yung yung genetics, no? Oo.
So, you cannot really generalize na mas prone ang lalaki or
Hindi.
mas prone
Per
ang
disease, pwede mo ma-generalize.
Okay.
Oo, pag ganon.
Alright, thank you for clearing that up, Dr. Salonga. Now let's go to the support group. How do you raise awareness for a rare disorder? Rare nga siya, no? So it's not really commonly talked about.
Right.
So how do you raise awareness for this?
Sa mga sa aming mga national conventions, no? Like national conventions ng neurology, ng child neurology, and then ng sa Institute ng mga Human Genetics, may mga forum kasi na mga ginagawa, but mostly for physicians. And I think importante kasi na maging very well aware ang mga physicians about these different rare disorders, no? Kasi mahirap nga siyang i-diagnose kung wala kang index of suspicion, and magkakaroon ka lang ng index of suspicion kung narinig mo na ay meron palang ganun sakit. Di ba, no? Okay, so that's one. For the families, I think we have now a support group, no? Na dito sa Philippines. I think this was initiated by the group of Dr. Carmencita Padilla, our new Chancellor of UP Manila.
Dr. Carmencita Padilla is a genetic doctor.
Geneticist siya.
Geneticist,
siya yung
yes.
nag-establish actually ng genetics dito sa Philippines, together with some parents ng mga bata or ng mga patients na merong rare disorder. So meron silang parang yung Philippine Society for Orphan Disorders, no? And then I think yun ang tumutulong sa mga pasyente na merong rare disorders. Tumutulong in terms of, I think, support group morally, and at the same time, they're trying to find yung mga medicine that may be able to alleviate the symptoms, no?
Okay.
Specifically, yung mga special formulation ng gatas para sa mga bata. No?
Kasi apektado nga ang infants, no?
Merong mga apektadong, parang merong mga metabolic disorders na may certain lang sila pwedeng kainin, parang gano'n, no?
Okay.
May mga special formulation na hindi naman commercially available, no? So, sino-source out nila yon from some companies na may advocacy naman for that.
So, short of saying, they're looking for a cure or just treatment or a control?
Alleviation. Sa ngayon, alleviation of symptoms at saka yung modification of symptoms, no? Ibig sabihin, para hindi naman masyadong mahirapan yung mga pasyente, di ba? And to give comfort to the patients, no? And to the families to be able to help them understand better, so that they will be able to care for their patients better. And then we have genetic counseling that these people in genetics are actually doing, no? Lalo pa yung mga nagpa-positive dun sa newborn screening test.
Okay. So there are a lot of forums that are being conducted for a better understanding, hindi lang hindi lang yung physician, no? Kasi
Yes.
hindi lang nung families, but to other members of
Members of the
society,
society,
no?
yes.
Who must understand also this rare disorder. Latest update, Doc, research and finding a cure for rare disorders.
I think in the Philippines, database pa lang yung ginagawa, no? Para malaman natin yung burden at disease ng itong mga rare disorders, no? In terms of research, internationally, ang researches are being focused on, one, yung mga enzyme replacement therapy, yun sa mga specific diseases na may mga enzyme deficiencies para ma-modify yung expression ng disease, no? And then the other one is, I think, ang pinakamalaking research is on gene therapy.
Okay.
Oo, so hopefully, in the near future, pwede. Kasi yun lang yata ang pwedeng makasagot dyan sa mga ganyan. No? Oo.
That's right. So in the near future, we'll have you back with an update on gene therapy here in the country.
Ang geneticist.
And a geneticist. Kasama ka na rin, a neurologist, doctor. Team kayong dalawa. Any final word or final message to all our viewers regarding understanding rare disorders?
Okay. Siguro, ang importante lang is make sure na we know what is causing, no? Or try to know what is causing the condition, the problem, before going right away into intervention. Kasi I think yun ang isang laging nagiging problema namin neurologists. When they come to us, malalaki na yung mga bata.
Na-skip yung
yung
finding the cause.
Oo, kasi yung mga nanay, syempre, gusto nila, sige, may intervention agad, so dadalhin na agad nila for, okay lang naman, mag-occupational therapy, mag-physical therapy, mag-SPED, pero ang importante, what's causing it? Ano ba yung dahilan? Bakit, halimbawa, may global developmental delay? Bakit may delay nito? Yun ba ay anatomical o yung ba ay merong bang something na maybe still be modified, no?
Okay.
O pag nalaman natin kung ano, no? And then family counseling and gene testing, genetic testing are very important components. Although alam kong sa ngayon yung genetic testing talagang mahal pa dito sa atin, pero the National Institutes of Health through the Institute of Human Genetics, tumutulong po sila na magpadala ng mga samples in our ka-network na mga laboratory to find out kung ano. Meron na bang ibang mga meron namang iba ng mga test na nagagawa tayo locally, no? So, depende kung ano yung sinususpect. Like for mental retardation, merong ibang test na pwede na nating magawa. So, let's make use of them para mas alam natin kung ano talaga yung meron yung ating mga pasyente, no?
Okay.
Okay, so yun siguro ang aking pwedeng, and we are here to help you.
Yes.
So with cases, if you have difficult cases, the Society of Philippine Neurological Association, the Child Neurology Society of the Philippines, diba? And people in the National Institutes of Health, in the Institute of Human Genetics, they offer services naman. Okay.
Maraming salamat for helping us understand and enlightening us on rare disorders, and that the society or the groups that you've mentioned are there to help all those who may have medical conditions such as this. Even if you're not diagnosed with that medical condition, just knowing in your gene pool that you have it, no?
Right.
You must have yourself diagnosed right away. Maraming salamat ulit, Dr.
Thank
Aida
you
Salonga.
also. Thank you.
We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night.